My research mainly focuses on biomarkers discovery and validation in genitourinary tumors, with a special interest in prostate cancer and testicular cancer. The study I'm going to present at this ASCO GU is focused mainly on a microRNA, which is a very small fragment of RNA that is secreted in the bloodstream, specifically by germ cell tumors. We evaluated this microRNA prospectively in a very early stage disease of testicular cancer, essentially to assess whether or not we can use this microRNA to predict relapse. In order to assess this microRNA expression, we used peripheral plasma, and the microRNA was extracted and measured by real-time PCR. We had the qualitative and quantitative analysis performed. We essentially analyzed 101 patients with clinical stage 1 testicular cancer after the orchiectomy, prospectively and longitudinally, with a long follow-up that exceeded the median time of relapse, so that we could be sure that they were not false negative in our analysis. And what we found was that our miRNA 371 detected in the peripheral blood was able to detect with a very high positive predictive value and specificity the presence of viable germ cell tumors in both seminoma and non-seminoma clinical stage 1. As I mentioned, this is a very important but still limited in terms of number of patients evaluated study. So we need a bigger number to validate prospectively this data, miRNA 371. And the SWOG trial S1823, it's open through SWOG and CCTG, will answer to the question of whether or not miRNA 371 could be used to detect minimal residual disease after orchiectomy and predict tumor relapse in these patients. And will be extremely important also to understand the timing of the switch eventually, if we will get low sensitivity immediately after the orchiectomy. The impact of this research, if our data will be validated in larger clinical trials that are currently ongoing, including the S1823 study that's sponsored in Canada and in the US through SWOG and CCTGA, it could be very relevant for patients with clinical stage 1 testicular cancer, because we could propose a very simple blood test after the orchiectomy for monitoring of tumor relapse, reducing or completely eliminating in some patients, especially in seminoma patients, the use of CT scan. We could use, again, if this data will be validated in a larger cohort, we could use the microRNA for assessment of presence of viable germ cell tumors in early stage disease. For example, in stage 2A, seminoma and non-seminoma with negative tumor markers, where our CT scan and serum tumor markers are suboptimal. So we still do not have very good diagnostic tools for these patients, and this leads to under-treatment or over-treatment, and that could lead to long-term side effects. So having a very precise and accurate biomarker will definitely decrease the unnecessary treatment for these patients.